1. Reducing medication errors and adverse drug events through data sharing. Medication errors and adverse drug events, ADEs, are significant contributors to patient harm, making medication safety a critical priority in healthcare. HIE can help mitigate these risks by ensuring that accurate and up-to-date medication information is readily available to all providers involved in a patient's care. How HIE reduces medication errors. Comprehensive medication. History. HIE allows for the sharing of a patient's complete medication history, including prescriptions from multiple healthcare providers, pharmacies, and even outside healthcare systems. By having access to the entire medication history, providers can better assess potential interactions or duplications, preventing harmful errors. Example: a physician in one healthcare facility can view a patient's prescriptions from other clinics or pharmacies, ensuring that no medications overlap or interact negatively. Drug interaction. Alerts. Many HIE systems are integrated with clinical decision support systems, CDSS, that provide real-time alerts for potential drug-drug interactions or allergies based on the patient's medication history. Example: if a patient is prescribed a new medication that interacts with an existing drug or their allergy profile, the system will alert the healthcare provider before the prescription is finalized. Medication. Reconciliation. HIE enables better medication. Reconciliation, which is the process of verifying a patient's medications at each transition of care. Accurate medication reconciliation helps prevent errors when patients are transferred between different care settings, e.g., hospital to home. Example: a patient discharged from the hospital can have their medication list updated in the HIE system, and the primary care physician can access this information to ensure the list is accurate and complete for continued treatment. Reduction of ADEs, adverse drug events. By ensuring that the complete medication profile is available at the point of care, HIE helps reduce the likelihood of ADEs, which are often caused by unintentional prescribing or dispensing errors. Example: if a patient is allergic to penicillin, and this is documented in the HIE system, the prescribing physician in a new facility will be alerted and avoid prescribing this medication. Second, HIE as a tool for preventing duplicate testing and redundant procedures. Duplicate testing and redundant procedures are both costly and potentially harmful to patients. They can lead to unnecessary exposure to radiation in the case of imaging tests, additional risks associated with invasive procedures, and increased healthcare costs. HIE plays a critical role in preventing these issues by providing healthcare providers with comprehensive access to a patient's previous test results and procedures. How HIE prevents duplicate testing and redundant procedures. Access to historical test results. By exchanging test results across healthcare systems, HIE allows providers to access a patient's complete testing history, including lab results, imaging studies, and diagnostic tests, preventing the need to repeat tests unnecessarily. Example: a patient who had a chest X-ray performed at one healthcare facility will have that result available to their new provider through the HIE, eliminating the need for a second X-ray. Avoiding redundant imaging and procedures. Providers can see not only the results of tests, but also the specific procedures that have been performed on the patient in other healthcare settings, such as specialist consultations, surgeries, and diagnostic procedures. Example: if a patient has undergone a colonoscopy in the past, a provider can access that report through the HIE, preventing the need for another colonoscopy when the test is not medically necessary. Integrated health records. The integration of different healthcare settings, such as hospitals, outpatient clinics, pharmacies, and laboratories, through HIE ensures that a patient's complete care history is easily accessible. This reduces the likelihood that a provider will duplicate a test or procedure. Example: a primary care provider can see a specialist's diagnostic tests, avoiding unnecessary repetition. Improved care. Coordination. HIE improves care coordination by ensuring that all healthcare providers involved in a patient's care have the same information, which helps in planning and managing tests and treatments effectively. Example: a cardiologist and an endocrinologist may need to coordinate testing for a diabetic patient with heart disease. With access to HIE, both can avoid ordering the same tests or procedures. 3. Real-time alerts and notifications for healthcare providers. Real-time alerts and notifications are essential for ensuring that healthcare providers are promptly informed about critical changes in a patient's condition, lab results, or medication regimen. HIE systems, integrated with clinical decision support tools, can help deliver these notifications directly to healthcare providers, allowing them to respond quickly and appropriately. Types of real-time alerts and notifications. Critical lab result alerts. HIE systems can be configured to send automatic alerts when a patient's lab results are abnormal or critical. These notifications are delivered directly to the provider, enabling a timely response to potential health risks. Example: if a patient's potassium levels are dangerously low, the system will alert the attending physician to take immediate action. Medication alerts. HIE can send real-time notifications to healthcare providers about potential issues with medications, such as dosage errors, drug interactions, or missing prescriptions. These alerts help prevent medication-related errors before they occur. Example: if a physician attempts to prescribe a medication that may interact negatively with another drug the patient is already taking, the system will provide a warning. Allergy and adverse event notifications. By linking patient allergy information in real time, HIE systems can notify healthcare providers if a prescribed drug or treatment is contraindicated based on known allergies, preventing adverse reactions. Example: if a patient has a documented penicillin allergy, an alert will pop up when penicillin is prescribed. Care transition. Alerts. When a patient moves from one care setting to another, e.g., from hospital to home or from a specialist to a general practitioner, HIE systems can notify the relevant providers of the transition, ensuring continuity of care. Example: a discharge summary alert is sent to the patient's primary care provider, ensuring that follow-up care and medication adjustments are made. Emergency alerts. In cases where a patient is admitted to an emergency department or is undergoing urgent care, real-time alerts are sent to relevant care teams to provide a coordinated response. Example: a patient presenting with chest pain is admitted to the ER. An alert goes out to the cardiology team, ensuring that they are immediately involved in the case. Addressing the challenges of health information exchange, HIE. While health information exchange, HIE, offers significant benefits for improving patient care and safety, several challenges must be addressed to ensure the successful implementation and sustained operation of HIE systems. These challenges can be broadly categorized into technical, organizational, and patient-related barriers. Addressing these challenges is essential for maximizing the potential of HIE in improving healthcare outcomes. 1. Technical challenges. System downtime and reliability. System downtime, whether due to network issues, software failures, or maintenance, is a significant concern for the reliable operation of HIE systems. If an HIE network experiences downtime, healthcare providers may lose access to critical patient information, leading to delays in care and potential errors. Solutions: redundancy and backup systems. HIE systems should implement backup mechanisms, including redundant servers and data storage solutions, to ensure continuous access to patient data even during system outages. Cloud-based solutions. Leveraging cloud technology can provide scalability, flexibility, and better uptime guarantees, reducing the risk of downtime. Routine maintenance and monitoring. Regular system maintenance and real-time monitoring can identify and address issues before they result in downtime. Data inconsistencies. Inconsistent or conflicting data is a major technical challenge, as patients may have information spread across multiple healthcare systems that are not always synchronized or updated. Data inconsistencies can lead to confusion, errors, or misinterpretation of patient information, affecting the quality of care. Solutions. Data reconciliation processes. HIE systems should incorporate data reconciliation processes, where data from various sources are cross-checked and consolidated to ensure consistency and accuracy. Data validation rules. Implementing validation rules during data entry can reduce errors. These rules should check for inconsistencies, such as conflicting diagnoses or medication records, before data is exchanged. Automated data. Normalization. Using algorithms to standardize data across various systems can help ensure that information is uniformly presented, reducing inconsistencies. Data standardization. One of the biggest barriers to the successful implementation of HIE is the lack of uniformity in the data formats used by different healthcare organizations. Without standardized formats, it becomes difficult to ensure that data is consistently interpreted and exchanged across disparate systems. Solutions. Adopting national and international standards. The adoption of standardized data formats and protocols such as HL7, CCD, CCDA, and FHIR, fast healthcare interoperability resources, can improve interoperability and streamline data exchange. Data mapping and translation tools. Tools that automatically map data from one system format to another can help in standardizing data for smooth exchange. Collaboration with standards bodies. Healthcare organizations should collaborate with standard-setting bodies to ensure their systems are compliant with the latest interoperability guidelines. Second, organizational barriers, collaboration and communication across healthcare providers. Effective collaboration among healthcare providers, whether hospitals, primary care physicians, specialists, or pharmacies, is crucial for HIE systems to function smoothly. However, differences in organizational culture, workflows, and priorities can create barriers to collaboration and communication. Solutions. Fostering a culture of collaboration, promoting a collaborative mindset through leadership, training, and shared goals can help break down organizational silos. Encouraging a team-based approach to patient care is vital for improving communication. Clear governance structures. Establishing governance structures and clear policies for data sharing can reduce confusion and help stakeholders understand the roles and responsibilities involved in the exchange of health information. Stakeholder engagement and education. Involving all stakeholders, including clinicians, administrators, and IT staff, in the planning and implementation of HIE ensures that each group understands the benefits, technical requirements, and workflow changes needed for successful integration. Financial and resource constraints. Implementing and maintaining an HIE system requires significant investment in technology, staff training, and ongoing support. For smaller healthcare organizations, these financial barriers can be a deterrent to adopting HIE. Solutions. Financial incentives and support. Governments and healthcare organizations can provide funding or financial incentives to assist smaller healthcare providers in implementing HIE systems. Cost-effective solutions. Investing in cost-effective, scalable HIE technologies such as cloud-based solutions can help reduce upfront costs while still enabling robust data exchange. Collaborative approaches to cost sharing. Healthcare organizations within a region or network can collaborate to share the costs of establishing and maintaining HIE infrastructure, making it more financially feasible for all participants. Data ownership and liability concerns. There are often concerns about the ownership, privacy, and security of health data. Healthcare providers may be hesitant to share data due to fears about violating patient privacy or being held liable for errors made using shared information. Solutions: clear data. Ownership policies. Establishing clear agreements about who owns the data and who is responsible for ensuring its accuracy can help mitigate concerns about liability and privacy. Comprehensive data security and privacy measures. Implementing strong encryption, access controls, and audit trails ensures that shared data remains secure and compliant with regulations such as HIPAA and GDPR. Patient consent management. Clear mechanisms for obtaining and managing patient consent for data sharing can help reassure patients and providers about the ethical use of health information. Third, patient participation and engagement in health information exchange. While healthcare providers and organizations play a central role in HIE, patient participation is also critical to its success. However, many patients are not fully aware of HIE systems or may be hesitant to participate due to concerns about privacy, security, or the lack of perceived value. Patient education and awareness. Educating patients about the benefits of HIE, including improved care coordination, reduced risk of errors, and faster access to care, is crucial for increasing participation in data exchange. Without patient buy-in, healthcare providers may not be able to access the necessary data to deliver the best care. Solutions: public awareness campaigns. Implementing educational campaigns to inform patients about the importance of HIE and how it enhances their care can build trust and encourage participation. Clear communication about benefits and privacy. Healthcare providers should communicate the benefits of HIE to patients and address concerns about privacy and security to gain patient consent. Consent and opt-out mechanisms. Patients should have the ability to provide informed consent for the sharing of their health information or opt out of certain aspects of HIE if they choose. Some patients may have concerns about the sharing of their sensitive health data, particularly if they have been treated for mental health or substance abuse issues. Solutions: informed consent processes. HIE systems must establish clear, transparent consent processes that allow patients to choose which health information they are comfortable sharing and with whom. Opt-out options. Providing patients with the ability to opt out of certain data sharing arrangements ensures that their privacy preferences are respected. Granular control. Overdata. Allowing patients to control which specific types of health data are shared, e.g., only medication history, not mental health history, can help address privacy concerns. Trust and confidence in data security. Patients must trust that their health data will be protected and used only for appropriate purposes. Without this trust, patients may be reluctant to engage with HIE systems. Solutions: robust data security measures. Strong data security practices, such as encryption, access control, and authentication protocols, are essential for maintaining patient trust in the system. Transparency in data use. Healthcare providers and organizations should be transparent about how patient data will be used, stored, and shared, and offer assurances that the data will not be misused. Future trends and innovations in health information exchange, HIE. As healthcare continues to evolve, so does the landscape of health information exchange, HIE. Innovations driven by emerging technologies like big data, artificial intelligence, AI, and machine learning, ML, as well as the expanding role of HIE in population health management and cross-border data sharing, will shape the future of healthcare data exchange. These trends are aimed at improving care coordination, enhancing patient outcomes, and driving efficiencies in healthcare systems. Below are key future trends and innovations in HIE,